Greetings from KIMS Hospitals, Mahadevpura. My name is Dr. M Fayaz. I'm Senior Consultant in Internal Medicine Department. So today we'll discuss about diabetes. Everybody knows what diabetes is. It's increased sugars in the body. So there are broadly three types of diabetes: type 1, type 2 and gestational diabetes. Type 1 diabetes is absolute deficiency of insulin production. Type 2 diabetes is insulin resistance. Gestational diabetes mellitus is insulin resistance in pregnancy. So ultimately there will be high sugars in all the three groups of patients. So what are the symptoms of diabetes? So we generally say that there are three P's, which is polyuria, polydipsia, polyphagia. So apart from these three P symptoms also, the patients can present with delayed wound healing, patient can present with numbness, tingling of upper and lower limbs, and multiple vague symptoms. Individuals who are at risk for type 2 diabetes include people who are having sedentary lifestyle, having high carb meals, and people at high stress jobs or high stress conditions. How to diagnose type 2 diabetes? So we have a criteria of fasting blood sugars, postprandial blood sugars, which are 2 hours after breakfast, and HbA1c, which is an average of 3 months. So fasting blood sugars of more than 125, postprandial 2 hours after meal blood sugars of more than 200, HbA1c of more than 6.5. We diagnose diabetes on these criteria. What are the symptoms when the patient should meet a physician? So first symptom would be polydipsia. Polydipsia is increased thirst. Patient has increased thirst. Polyuria means patient has increased frequency of urine. Polyphagia means patient has increased appetite. So patient eats a lot. So along with this, there can be other symptoms like delayed wound healing, generalized weakness, fatigue, and sleeplessness. Why should we treat diabetes? So patients who are untreated for diabetes will land up with complications. They are called as microvascular complications and macrovascular complications. Microvascular complications include diabetic retinopathy, diabetic nephropathy, and diabetic peripheral neuropathy. And macrovascular complications include ischemic heart diseases, cerebrovascular accidents, and peripheral vascular diseases. Treatment of type 2 diabetes include lifestyle modifications, which include good amount of physical activity, diet changes like increasing the protein content in the diet, increasing the fiber content in the diet, reducing high glycemic index foods, and reducing fats. Along with this, your doctor will prescribe you medications or a combination of medications with insulin depending upon the requirement. For any further queries on diabetes management, please get back to us. Just contact Internal Medicine Department, KIMS, Mahadevpura.